Radio, and it's 2:40. This is Talk of the Nation. I'm Neil Coonan, and here are headlines from some stories we'll follow today here at the Libyan rebels continue to reinforce their positions in the town of Brega and important oil installations on the Mediterranean coast. Yesterday,
Hello everybody, just killing a little bit of time here. Taking a ride around town here before I have to go to work. I'm a little bit early, so been a while since I made a video for the Astro Safari channel, so this is something to make a video. Thought I'd make a video. So, let you know I'm still alive. Been concentrating mainly on the vinyl channel lately, but I've been real busy lately. Haven't had much time to make videos. Been busy with a lot of things that I can't make videos about, and but time to make a video. So just enjoy the ride around. And just shut up. Go for a little ride. Well, I burn up some of this little precious liquid gold here.
Thank you, Neil. And can you explain what we're talking about? What is a pulmonary embolism? Well, a pulmonary embolism is when a blood clot that's in the...
You're going to see a lot of them around here.
Which is the tubing circulatory system that brings the blood back to the heart. Not to be confused with the arteries that bring the blood from the heart out to the body. And when clot forms in these arteries, it can move. It's soft like jello, and it can embolize. So the word embolize means to move from one place to the other, and it can move from the extremities into the heart and lungs, cause a distress in terms of breathing. And as I understand it, usually begins in the left. One of the most common sites is from the legs, but it can be elsewhere. And how do you diagnose this? How do you find out you've got it? Most of the time, there's a suspicion that it occurs because of pain and swelling in the leg following either a prolonged
I've been in that house before.
Bed rest or
Long time ago.
Having a cast on,
so it's pretty
injury
worn out.
Or surgery, being laid up after an operation is a very frequent cause of deep venous thrombosis. So after it's suspected, then it's usually diagnosed by what's called an ultrasound. So deep venous thrombosis, or DVT, that's what it is before it gets to your lungs, then it becomes a pulmonary embolism. That's correct. Okay. And so you would notice some swelling in your leg and pain in your leg, and again, it usually is a result of somebody who can't get up and walk around. That's correct. And then once it's gone to the lungs, you figure out you've got it. Well, usually we pick up that it's gone to the lungs when the patient, after being diagnosed with a deep venous thrombosis, has either chest pain or shortness of breath. But sometimes you may not notice it in your leg, or you may ignore it, and it could just wind up in your lung. That is correct. And what are the symptoms then? Well, when you don't have a diagnosis of it in the legs, you just present with chest pain or shortness of breath. Occasionally it's just a discomfort or a sensation that you're not getting enough air. Shortness of breath? Shortness of breath, meaning that you're aware of the fact that
plan on doing my rear brakes this weekend on this thing. They're getting pretty bad and pulsating. Pretty weak, so I'm going to redo the rear brakes this weekend, probably. It's also supposed to rain this week.
People who fly a lot are in cramped situations and spend a lot of time on airplanes. Yes, people, especially on what's called long-haul travel, which is generally considered around 5 to 7 hours of flight. And it's not just the flight time, it's the time that you're sitting around and not moving or stuck on the flight.
Looking into getting me some kind of camera mount for in here for this thing.
A lot of the airlines now are quite
Took some videos the other night of some nighttime driving, and I tried to prop it up on the dashboard. Hold on to it, but all you can see is the windshield wiper in the way.
Also exercises you can do in your
seat.
That's correct.
And it's also important, as I understand it, to make sure you're hydrated. Drink a lot of water.
Hydration is important. Moving the feet and the ankles around. Some people will wear support stockings that help empty the veins out. It's the staticness of the blood in the veins that causes the clot.
And what, taking something like an aspirin, a mild blood thinner?
Aspirin is not as useful as other blood thinners.
Other blood thinners, though, might be more difficult to get.
Yes, they can be, and somebody with a history of this that's flying would do well to discuss it with their private physician and get a blood thinner.
Another victim of our many arsons that we've been having around here last year. That used to be Homedale School.
So a long-acting heparin could be.
Well, this is going to turn out to be a depressing video.
Similar to insulin that diabetics use, and injected and would last the whole trip. And then
but this is home. This is where I'm at.
On the return trip.
I don't live exactly inside the city limits of Flint, but I'm over here a lot. So, live about 5 miles outside of the city.
Nate is on the line from Richmond in Virginia.
Hi, how are you?
Very well, thanks.
Over here most every day.
Bilateral pulmonary emboli, and I was actually driving in my car when I started feeling the pains in my shoulders, and about 30 minutes from the
Listening to the stuff about lemonade. Oops, we got that blocked off.
Wow. And how did it manifest itself?
I had pains in my legs, I guess about 2 or 3 days prior to it, but I was really just in the car coming home from a trip.
Well, I was going to go down that way.
Shoulder and chest, I thought I was having a heart attack.
And it then just continued to drive to the hospital.
Yep, went to the hospital, and as soon as I got in, they ruled out my heart, did a chest x-ray, and when they saw the x-ray, immediately started. I was on heparin, they put me on Coumadin, I take Coumadin all the time now.
And that's another blood thinner?
Yes.
All right. And you feel fine?
I feel good. I don't like the side effects of Coumadin, but blood thinners are blood thinners. But yeah, I feel better now, and they never could.
Yeah, you definitely want to keep your doors locked around here.
Well, that's interesting. Nate, I'm glad you made it.
Yes, me too.
Thanks very much for the call. And it's for doctors to be unable to figure out what caused the birth.
So Nate's story is a very common one. Somebody having taken a long trip had noticed some pains in their leg, maybe some swelling, but they really don't present or consider it serious until they develop the pulmonary embolism, which is noted by the chest pain and difficulty breathing. It's very common not to know the exact source. Sometimes the entirety of the clot has now moved up into the lungs, so investigation of the source in the legs would be negative.
Let's see if we get another caller in. This is Zach. Zach with us from Savannah.
Yes, hello, how are you?
Good.
Well, my wife is actually the one who suffered bilateral
Icy
emboli.
right here.
And I was just gonna,
That's the Flint River right there.
The only risk factor that doctors could think of with her would be hormone birth control, because she was 25 years old, young, good health, walking around, didn't really have any long trips that she was on. And she actually didn't have chest pain, just severe back pain, which nobody really caught until she collapsed, and we took her to the hospital.
On Broadway.
Well, actually, when we got to the emergency room, her pulse rate was very, very high, and her blood pressure was very, very low, so they figured immediately pretty much that it was a blood clot.
Dr. O'Donnell, can hormone
Well, I can't go that way. What am I doing?
Well, this is a very important point that's brought up. It's been looked at quite closely. Estrogens and hormone supplementation is associated with an increased propensity to develop clot. It's caused a rethinking of how the gynecologists recommend hormone replacement in elderly women, and the amount and dosage of estrogen in birth control pills.
Zach, how's your wife doing?
She's doing well now. She's off her blood thinner
Nice looking old 80s Cutlass. I wouldn't mind having that in my driveway.
No, it shouldn't be ignored. Anything that doesn't go away and nags at you for most of the day and isn't fleeting is usually something that's worth paying attention to.
Here's an email we have from Sophie. Thanks for bringing this topic up. My husband, very healthy, 49-year-old man, had a knee replacement in November. The doctor gave him blood thinners for 10 days. He did a pulmonary embolism 17 days after the surgery. He died in 1 hour. No pain, no swelling. He was walking, driving, doing physical therapy.
That used to be Brown's funeral home.
About this, so are there cases like that where just no warnings at all?
Well, we're very sorry for Sophie's loss. That's a tragic circumstance. It is true that pulmonary embolism is one of the most common causes of death after elective surgery. No surgery is minor, and this is a problem that occurs. Some people are predisposed to it by hereditary problems that causes them to clot.
Have to go in there one of these days.
Reporters during the Iraq.
I haven't been doing a lot of thrifting lately.
One of these disorders. So it is important, and these are often patients where they have no symptoms or known problem until they undergo some.
Say the lights are shining bright on Broadway.
Find out if you're one of those people who's genetically exposed to it.
Well, if you have a history in the family, you should take it up with your primary physician to see if you should be screened. There are blood tests that can screen for these genetic disorders.
Talking with Dr. Sean O'Donnell, Director of Vascular and Endovascular Surgery at Washington Hospital Center. We're talking about pulmonary embolism too. This is the total patient from India. Let's go next to Eric. Eric, this is Grand Rapids.
Hi, I'm 28, and I just did a massive pulmonary embolism in December, and I had it for months. It wasn't actually something that just immediately hit. The doctors figured that little clot kept breaking off. They couldn't even find the clots when they looked for it.
And how did you find out you had it?
Well, one day I was fine 1 minute, and then I tried to stand up, and I almost fell down. And then my skin started turning gray, and my fingers started turning gray. They got me to the hospital, and I was going into shock, and my organs were shut.
Wow. And then they found out in the emergency room that you had this?
Yep, they gave me a CT scan. They had problems with sonograms because they couldn't actually find my heart when it was beating so slow. So they just basically stuck me on a super clot buster, which has about a 1 in 5 chance of killing me too.
And how long did it take before you started feeling good?
I responded really well to the super clot buster. Within probably 3 hours, my vital signs shot back to normal. My heart rate went from about 170 resting rate to about 60.
How common, Dr. O'Donnell, is something like this?
So it is less common to have what it sounds like Eric had what we call a massive pulmonary embolism. And a massive pulmonary embolism usually blocks up most of one of the pulmonary arteries or involves both pulmonary arteries and can severely limit the amount of blood that can go through
Ball
the lungs.
fields.
Results in low blood pressure and can result in death. This is less common, but it certainly occurs. The clot dissolving medications that Eric talks about are thrombolytic, and they can be life-saving in dissolving the clot.
Don't even try it.
But are only used in these cases where it's a life and death situation because there are significant risks to the medications.
Eric, you continue to take blood thinners?
Oh yeah, they couldn't find any reasoning for it, so I'm going to be on a lot of pills for a long time.
Sorry to hear that, but I'm glad you made it.
I am too, thanks.
All righty, Eric. Here's I guess a text we have from Dwayne. I'm an over-the-road trucker. Could I also be at risk? And you have to think it's not just truckers, but even people who sit in cubicles.
Yes, no, we haven't seen that a lot from office workers that are at their desk. I suspect because they take frequent visits either to the or the water cooler. Truckers often do long hauls, and we have seen this in this group. Any train, plane,
Got not a lot of nice classic cars in there. There's a 70s El Camino in there.
A 5 to 7 hours puts a person at risk, and they should be aware of that
Nice
and how to prevent it.
old Chevy
One
truck.
more caller in. This is Pam. Pam with us from Oakland.
Hi.
Hi, Pam.
Hi.
Go ahead. I'm here.
What I wanted to talk about was that I was in the hospital. I had a benign brain tumor, and I had concussion talking to the hospital. But what didn't happen for me is I was not given discharge instructions. I was not told often how much it was, and it was not told the symptoms. I did nothing, and I developed my leg was stiff. And then I developed an embolism, and I survived, but I had no information about my risk.
Well, Pam, we're glad you made it through. Tell me, was the tumor that you had, was that a benign tumor?
Meningioma, yes.
A meningeal?
Yes.
It's worth noting that patients with cancerous tumors are also at higher risk, because many cancers can make the blood thicker than it should be. But any type of surgery or hospitalization is a risk for deep venous thrombosis.
Got 5 minutes left on the chip here. I want to show you guys something before I shut this off. Really sad.
Measures to be taken as immediate.
Bunch of traffic here.
Pam, thank you. We're going to cut it off there. Yeah, appreciate it. Dr. Rob, thanks very much for your time. You're very welcome. I don't know about you, but I'm going to have a drink of water and get up and walk around.
There you go.
Okay, Dr. Sean O'Donnell joined us by phone from Washington Hospital Center, where he's the Director of Vascular and Endovascular Surgery. Tomorrow, Talk of the Nation Science Friday. Ira Flater will be here with a look at climate change and national security with the Navy's Chief Oceanographer. This is Talk of the Nation.
Oh, my
from NPR
phone's
News. I'm
ringing.
Neil Tuck, Washington.
I'll have to get that later. Well, they're $3.50 a gallon here now. Yesterday they were $3.55, so they've actually gone down a little bit. You see that big field right there? That used to be the AC spark plug plant, which was later Delphi. Tore that down about 2 or 3 years ago. Really sad. A lot of people spent their lives in that place and built this city. Not only that, there's a couple other big plants torn down. They're not here anymore, like Buick City and Chevrolet. Sad situation. I don't know if things will ever be like they used to around here. Yeah, I gotta find out who's calling me, so y'all have a good day. We'll talk to you later.